guys, thanks for watching my pregnancy video. This is going to be part 2, my delivery. So the video is just going to continue on from, I guess, where I left off. But this is just what happened to me during my labor and my delivery. And then my next video will be about like postpartum and what went on with me postpartum.
Are you ready to have a baby? Yeah, you got the easy job.
Been ready since 12.
Here, and the OB that I had was not there. You know, I figured that he scheduled me to be induced, that he would deliver my baby, and that was not the case. Which he didn't, I guess I didn't ask, but, you know, just assuming that he scheduled me to be induced, that he would deliver. But I met a new team of doctors, and they were really nice. I had the OB that had told me that my son had a cleft. He was, I guess, the main doctor, and then there was a doctor underneath him that was, because I delivered at a university hospital, so there was lots of residents, and I don't know what, you know, what's it called? What the hierarchy is about it, but it was the doctor that diagnosed my son's cleft, and then a doctor below him, and then I guess there was a doctor that was she didn't have very many, I guess, births under her belt because she was pretty excited. But anyways, then there was the couple nurses and the pediatric team that took care of Calvin, and the NICU team because he was born with a cleft. They really didn't know what to expect after birth with him. So there was a room full of people, and I got an epidural. Yeah. I was excited about that, but I think the anesthesiologist was a little bit nervous. I'm not sure. He was a little nervous. Yeah. And whenever I got my epidural, I was in like a really uncomfortable position. I had my knees up super high, and my feet was on my husband, and my husband was holding me like this, holding my legs, and it was kind of uncomfortable. I should have told him like that, you know, that I needed to move or adjust myself because I was not comfortable at all. I don't know, it was really awkward. It was an awkward spot, and he did my epidural, and I had shooting pain in my foot, and I had told him about that, and he's like, "Oh, I'm sorry," and evidently he had to redo the epidural, so evidently he moved it up a little bit, or down a little bit, but yeah, he redid that, and it was good. And because of my heart condition, they had to they couldn't give me a full dose of the epidural. They had to kind of slowly introduce it into my system. So I was just thankful to have it. And actually with my second, I got an epidural too, and I was very excited about that. And I really didn't need any more than like the slow introduction of the epidural. I like could still feel my feet and everything. It just took the edge off, and I was good. But this time, I was, I don't know, I started feeling pain, and I asked for another dose of it, and he came in and gave me some more, and then I was really super numb. So, I couldn't really feel my feet or anything like that. I was pretty numb. And, I used the peanut ball and kind of got him down. It was a longer, I would say it was in between my first labor and my second labor. My first labor, it drug on a long time. And I don't know, it was probably even longer because I was in so much pain. It just made it feel so much longer. But with my second pregnancy, I was able to walk around the hospital, and I was able to kind of walk her down into my birth canal, and it was a pretty fast labor and delivery. So, third time around, it was kind of like in between those two. It was a pretty long labor, which I was surprised because I thought that, it would be fast. It would be faster than my second. Each time, it just gets faster. That wasn't the case. Since there was, COVID precautions, I wasn't able to leave my hospital room. So I couldn't walk the hallways, and so I was kind of in bed the whole time, which I don't know if that was good or bad, but, I was in the bed the whole time because one of the reasons I had to go to the bigger hospital, too, is because I had to be hooked to the telemetry to monitor my heart while I was in labor. So I had the blood pressure cuff on the whole time, and I had the little button things, and they was monitoring my heart. It was kind of like the EKG, kind of like a constant EKG, I think. I don't know. Don't quote me on that. Actually, just erase that. They call it telemetry. But, yeah, I was hooked to that the whole time. So it was just kind of hard to get up and to move around. Of course, being pregnant, had to go pee a lot. And being hooked to fluids, had to go pee a lot. So up the bed, that was the most that I got out of bed, was just to go use the bathroom. So I think that kind of slowed my labor down. And it was time to push. Well, they checked me, and I was at a 10 with a lip, they said. So they was going to let me labor down. So luckily, I couldn't feel anything down there. So I was just happy. I was like, okay, whatever. And yeah, I guess sat there with him crowning for a little bit and let me get fully dilated to a 10. And so I was ready to push, and I think it was the doctor that she hadn't been at very many labors, very many deliveries. So I was starting to have a contraction, and she's like, push, push, push. And she was like really, really enthusiastic and excited. And I pushed. I think I pushed maybe 4 or 5 times, and then delivered him. And got to meet him. Me and my husband got to meet him, and they cut the cord and wiped him off, and it was probably like a half an hour that he was at the little bassinet thing, and they were getting him all situated and all, I guess, suctioned out and everything. And I got to hold him again after half an hour, and they had to put like a little pulse ox monitor on his hand. And yeah, he did good. He did great after delivery, and his cheeks were so full. He was the biggest baby that we had. He was 8 pounds, 10 ounces, and just as cute as can be. Like I said, lots of cheeks. And after delivery, I was sent to the perinatal unit, postnatal unit. I don't know. What was it called? I guess it's where they take C-section moms after they deliver. It's not really like, it's antepartum. That's what it's called. The antepartum unit. And I had to be there for 12 hours because they had to monitor my heart for 12 hours after delivery. So I did good in there. I guess my heart was fine, and thankfully everything went good, and I didn't have any issues with my heart during delivery or after delivery. At the 12-hour mark, I was getting ready to be transferred to postpartum, and they had brought the wheelchair in, and I needed to go use the restroom before I went, and I sat up in my bed and had the biggest headache of my life. It was, I guess they asked me on a scale of 1 to 10 what it was, and I said it was a 12. It was beyond a 10. It was the worst headache of my life.